We're going to begin this morning, though, with this. The growing controversy over a warning from President Trump about the active ingredient in Tylenol. The president is urging pregnant women not to take acetaminophen, claiming it can increase their children's risk of autism. But he offered no new facts to back that up. In fact, there are no scientific studies, repeating, no scientific studies that directly confirm any such connection. Chief Medical Correspondent Dr. Jon LaPook is with us to help you understand the implications of all of this. John, good morning to you, and help.
Good morning. Major medical groups are pushing back against yesterday's announcement, including the doctors who treat pregnant women. The group that represents them called the announcement highly unsettling.
If you're pregnant, don't take Tylenol.
Without providing detailed new evidence, on Monday, President Trump reversed decades of medical advice given to pregnant women, urging expectant mothers to avoid taking medicine containing acetaminophen, the active ingredient in Tylenol.
Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it.
According to the administration, using acetaminophen during pregnancy is associated with an increased risk of autism. The Food and Drug Administration plans to initiate a safety label change to reflect the new advice.
So obviously people are scared.
Dr. Stephen Fleischman is the president of the American College of Obstetricians and Gynecologists.
You should not, under any circumstances, avoid taking acetaminophen if you have a fever early in pregnancy, if you have a headache, if you have some other condition in pregnancy. We want you to take that medication. And we think that the overwhelming evidence that we have seen over the last 20 years does not show causation for acetaminophen causing autism.
The maker of Tylenol said, "We believe independent, sound science clearly shows that taking acetaminophen does not cause autism. It's the safest pain reliever option for pregnant women." That's because medications such as ibuprofen and aspirin are already discouraged for pregnant women due to risks of miscarriage and birth defects.
Today, we found that there's no new studies. I think we were hoping that maybe there was some new information that they had that they were revealing to the public, but really they just reinterpreted old data and decided to make this change.
I think it's also worth noting that even in the official release about all of this, the FDA wrote, "It is important to note that while an association between acetaminophen and neurological conditions has been described in many studies, a causal relationship, so cause and effect, has not been established."
You know, John, this is so upsetting for a lot of people. I have a couple members of my family who are pregnant right now, and I called them yesterday to check on them to see how they're processing. They said they're all just going to listen to their own doctors. But I think it's tough when you have the president saying one thing so strongly and then doctors saying something else. The tone is different from both camps.
Yeah, I was very much struck by that. So you had President Trump who's saying very definitively, don't take it. And then you have Dr. McCarry, the head of the FDA, with a more nuanced approach. And in this letter that came out after the announcement, I want to just read the first line of sort of the last paragraph. "In the spirit of patient safety and prudent medicine, clinicians should consider minimizing the use of acetaminophen during pregnancy for routine low-grade fevers." And then he goes on to say, look, it should be also, yes, should understand that it is the safest alternative in terms of lowering fever and lowering pain. It's safer than aspirin or ibuprofen, which can cause problems during pregnancy. And fever alone can cause problems with the developing fetus.
But that's the thing. You have the president saying, tough it out. Number one, I think it's tough for any man to say to a pregnant woman, just tough it up. Tough it out.
Really shouldn't be said.
Yeah,
to be honest,
I think for any man. And he said there is no downside.
Yeah, first of all, tough it out is not the message here because, as we were saying, that, you know, if a woman does decide, think of the message. If a woman says, you know what, I have a fever of 103, 104, but I'm going to tough it out because I care about my baby. Well, in toughing it out, you may have this very high fever that may go ahead and damage the developing fetus. So I think it's very tough. It's tough messaging. It needs to be nuanced. I very much appreciated Dr. McCarry's tone in this letter. I really did. It was the way doctors want to hear it, not just saying this is what you do, but here's on the one side, here's on the other side.
In the case of autism, there's now a drug that the White House plans to approve, or the FDA plans to approve to treat it. I can't pronounce it. You probably can.
Dokoupil.
Yeah, what can you tell us about it?
Well, I spoke to Dr. Richard Fry yesterday. He's been doing research on this for 20 years. It's really interesting. It turns out that there are some kids who have autism, and they have an antibody that prevents folate. You know, you take folic acid during pregnancy because it's very important for the developing brain and other parts of the body. It prevents the active form of that from getting into the brain. And so even though if you're taking folic acid, you may not have enough folate in the brain. And so folinic acid, which is also leucovorin, is a way of sort of getting around that problem and getting enough folic acid, enough folate in the brain. They're going to do more. I'm interested in this. This is very compelling. There's some really interesting science. They're going to do some big studies on it, and we'll see what happens.
All right.
Right.
High stakes, a lot of nuance. Dr. LaPook, thank you very much. Appreciate it.
Thank you.